Hello everyone, this is Bob Browner with Community Update number 17. Themes today is it worth all the effort we're putting into this, and if we start opening up, what are the metrics we should open by? So again, like I've been saying lately, this is not a either or decision, and most of us are sort of stuck in the middle. We're worried about coronavirus, we're worried about the economy, we're worried about what the government will or won't do. I think it's really right to be in this position that we need to start talking about this. Last time we talked about, trying to balance these two. I think most people have not, there's some folks on either side of the political spectrum that are focusing only on the health impact of coronavirus, but ignoring the economy, and some only looking at the economy, but ignoring the health impact of coronavirus and even believing some of the misinformation out there. We need to balance these two, and how would we balance these two? And last time I said, hopefully some social scientists would put together some estimates of what this is, and it turns out some have actually, so that's what we're going to talk about a little bit today. So in the Harvard Roadmap to Pandemic Resilience that was released a few weeks ago, they actually do have some comments about what they think the cost of this economic shutdown is costing us. And they cited somewhere in the range of $100 to $350 billion per month. That's a lot of zeros, more zeros than most of us are ever going to look through in our lives, but that's a lot of money. And but also it's a pretty wide range, so they still don't know the full cost of the economic shutdown. But a few months ago, we had no idea for sure what the true cost in lives were. And so what this is sort of a way to look at that. And this is in the area of what's called cost effectiveness analysis, or quality adjusted life years is a common metric used. I did some of these calculations in grad school. I took a course in it. It's been a while, so I'm a little rusty, but this is just kind of illustrate the concepts that essentially you would take how much do I think it's going to cost times 3 months times 6 months versus how many lives would be potentially saved. Is it worth the cost in the end? Right now we're getting some better ideas. So last time a video we talked about what those costs are, and that this is not just influenza. This is likely in the 10 to 20 times worse than influenza range at least. Most experts out there think the infection fatality rate's in the 0.5 to 1% range. So this nationally in this 1.6 to 3 million range is a potential the cost of doing nothing. So we of course don't want to do nothing. The other thing to keep in mind, and there's a myth out there that's only old people who will die, and actually no, there's actually a lot of people who are still in the primary life dying as well. I did see an analysis said on average the people who are dying from coronavirus are losing about 10 years of life. So it's not just people who are going to die soon anyway. There are some of those, of course, but there are also a lot of people who wouldn't have died soon anyway. But on average it looks like it's about 10 years. So if we took a look at this, we would say, let's use the middle of that range from Harvard and say $225 billion a month. We could look at 3 months, we could look at 6 months. We could also look at that lower range of 1.6 million lives lost and say, okay, what is the cost per life of this versus this? Per life, it's about $421,000, but if you're losing 10 years of life expectancy, that's 10 whole years. So you divide by 10, and that would basically say that for every life saved, or every year of life saved, it's roughly $42,000 to $84,000 if we continue for 6 months. We may use that to say, you know what, we can do this economic shutdown for 3 months, but not for 6. At 6 months, it actually starts becoming cost prohibitive. And almost all other countries actually do these kind of projections when they decide what's going to be covered, what's not going to be covered. We don't tend to do that in the United States, which is probably one of the reasons why our healthcare is so expensive here, is we kind of ignore costs for the most part. What is a normal range? Well, a lot of people use the ranges of $50,000 to $60,000 per quality adjusted life year in other countries. Some may go as high as $175,000. And this is a study actually in a journal where they actually did do some of these costs. For example, the cost of treating heart disease in this study was around $88,000 per year of life saved. So this isn't the range of what we're talking about. Again, these are just rough projections. I'm a little rusty in this, but we should start having people put together these projections and really having a good discussion. We can start quantifying this a little bit, and of course the numbers aren't going to be perfect, but at least gets us in the ballpark, because we have people who seem to think money is no object and people think that life's not worth any money. Well, it's a little bit in between, and we're going to make some tough decisions. So we need to start weighing this, and I think it needs to be done a little bit better than it's being done right now. The public health principles that Johns Hopkins put out for reopening actually talked a little bit about this. One of the things that I think I really like in the recommendations that decisions in this should be a multi-stakeholder, multidisciplinary process. This isn't just business people who should make a decision. It shouldn't be just public health people. You wouldn't want business people making the only decision because they sometimes care too much about money. You don't want public health people because they're only thinking about the lives, not the money. You really need both people in the room, and frankly, not just them. You may need a health economist. You might need an actuary. I think medical ethicists in the the clergy should be part of this. We're talking about potentially sacrificing lives for money. I think I'd like to have clergy and some ethicists in the room. I think this is the kind of stuff we're going to have to start doing. I hope our politics will enable us to actually have these kinds of conversations in the near future, because there are some really hard decisions that are coming up. So I think this is one of our next stages of development, is will we start quantifying this and making some open, transparent decisions? Because if these decisions get made behind closed door, boy, could things get ugly in a hurry. We have enough partisanship and mistrust as it is. It'd be really bad if these kind of decisions were being made behind closed doors without good input. And hopefully these would be bipartisan decisions, not one made by just Republicans or just Democrats. The next question is about opening and when to reopen and how to reopen. I think we are going to have to reopen to some degree. It's a question of how much, how soon, and what barometer we should use. I do think that this put out by Johns Hopkins is the right model, and I'm happy to see that that Lincoln is using this, and that Mayor Lear and Gaylor Baird is using this 14-day reduction model. I think this is the way to do it. I think the wrong way to do it would be use hospital supply as your model. And there's a couple reasons for that. So one of the things is you should be looking for a 14-day decline. We're not seeing that. So actually in the last couple days, last few weeks, it's gone up dramatically, and even just the last 24 hours, it's gone up quite a bit. So so I would use this. Are we able to ready to open everything up right now? No, although I do think we could start opening things up that we think are safe to do. Like, for example, riding down the bike path is fine even without a mask, I think. I think there's some things we can do, like going to some of our businesses as long as people wear masks. So I think we can open creatively, but I wouldn't say it's not time for the all clear. What I really hope we don't use is hospital supply as our decision to open up. So right now I've heard people say, you know what, only 1/3 of the ventilators are being used, so we could certainly open back up and we can tolerate a little more. The problem with that thinking is that is the time lag problem. And so by the time you know it's going, right now you may think we're overreacting, but we're probably not. We actually may be on the upswing here. The time lag problem is a big problem with the coronavirus, and this is why our projections are so hard. The time lag from getting infected, you might take a week to get symptoms, you may take 3 or 4 days for you to end up in the hospital, another few days for you to end up on the ventilator, and you could be in for a 2-week ICU stay in the ventilator potentially if you die. Now you may live too, but even then you may come out after 3 weeks on the ventilator and walk out of the hospital. But this time lag means from the time of infection to get it to either dead, living or dead could be 3 to 4 weeks. That creates a huge problem with prediction. And so by using that, it's like driving by looking in the mirror, because basically our hospital supply is based on the infections that were occurring 3 weeks ago, not the infections occurring today. And this is actually our map. So the fact that 1/3 of our hospital beds, ICU and ventilators might be open is because we weren't doing with much of an infection 3 weeks ago, but now we're doing a lot more. So in the next 3 to 4 weeks, you're going to see the ICU beds go up quite a bit and the ventilators going up quite a bit. And the question is, are we still on the upswing here, which we very well might be. So to use that as a metric would be like driving while looking in the rearview mirror. That assumes the road's straight. If the road's straight, you can just look in the rearview mirror, but the road may turn, and the road right now is turning. So this is not the time to be using that. You should be looking at the number of active infections as your decision maker. Keep in mind, we also are in this for the long haul. I think we are headed to a point where we're going to have to make lots of judgment calls about how safe, how open, what should we do. I do think there's a lot of ways for us to start opening up our business and start getting around the community, but do it in a safe manner. The single biggest thing is to wear a mask, and I'm not sure I quite understand the resistance. I know people don't wear a mask if someone's telling them to wear a mask. The Japanese don't wear masks because they're ordered to wear masks. They wear masks because it's the right thing to do. We need to start doing the same thing. This is me wearing masks, and so I wear a mask whenever I go to an enclosed environment like a grocery store or a workplace. These are 2 examples. I do not wear a mask when I'm riding my bike down the bike path or walking the dog, or when we have our neighborhood get-together where we sit 6 feet apart with our own chairs and our own cooler. As long as we're maintaining that distance outside, I don't think you need a mask, but in an enclosed space with multiple people, you should be wearing a mask. One thing I'd like to talk about a little bit is the Norway versus Sweden idea. Some people think Sweden, quote, didn't do anything. They actually did do quite a bit, they just didn't mandate it. So they didn't mandate that everything closed, but they did heavily encourage people to do things like wear a mask and space themselves out. The Swedes are actually naturally somewhat set up that. They have one of the lowest people per household, so they're somewhat built-in socially distanced. Despite that, they aren't doing quite as well as Norway, but economic, from all things being considered, maybe it's good enough. But wearing a mask is something you can choose to do. You don't have to have the government to order you to be nice. You could just be nice because you're Nebraska nice and you're a nice person and you care about your fellow man. And so wearing a mask is just the courteous, nice Christian thing to do, or whatever religion's philosophy you have to be. By you not wearing a mask at the grocery store, you're not showing your civil disobedience. Well, you are, but you're also potentially killing the person next to you, and that's just not a nice thing to do. So if you're out in a grocery store, wear a mask. It doesn't cost much. There are lots of people out there making masks. This one was given to me by my niece's mom, who's just loving the fact that she's got great reasons to make lots of masks for people. So I think when we open up, we're gonna have to open up differently. I think we can open up a lot as long as we do it safely. And just remember, your individual decision isn't just your individual decision. Your individual decision could be the difference between one person being infected and hundreds of people being infected. All that takes is for you to wear a mask. So hopefully this is helpful. We've been putting all the videos. People keep asking. I put them on the nonprofit I run, healthylincoln.org. We're just putting them on the face page. They took up too much of the space, so we actually have a link to the full list, but we'll keep the last 4 or 5 on that. This is what I do for a living. They are not. What I'm saying is not necessarily the opinion of any of these organizations, but it does inform why I talk about these things, because all these rules do have quite a bit to do with coronavirus, and they're all having hard decisions to make right now, just like you are.